Hi, welcome back to Orange Therapy on YouTube. My name's Julie. I'm a professional counselor in South Carolina, and that's my co-counselor, Ed. Have you ever wondered what an anxiety disorder is, what it looks like, and how you can improve from the symptoms to not be diagnosable anymore? Well, you have come to the right place. That's exactly what we're going to talk about today. Sit back and let's learn about anxiety disorders together. All right, so welcome back. There is a difference between anxiety and anxiety disorders. Anxiety is experienced by everyone occasionally. It's the normal day-to-day worry, maybe about finances or family stressors, concern about tomorrow. And generally, anxiety moves us toward action. We feel a little bit of discomfort. We recognize that there's a need. Maybe my bills are piling up. I need to get an extra shift at work, or I need to not spend as much. So our anxiety causes us to recognize there's a problem and we need to correct it. Fears are something that when we experience a fear, we want to avoid that thing. So if, let's say, a fear of heights is actually a very appropriate type of fear to have, a healthy fear of height, that is kind of hardwired into us so we don't hurt ourselves. But it becomes an anxiety disorder when the anxiety level is heightened in a way that it impacts our activities of daily living. So it impacts our sleep and our work and our normal interactions, our ability to engage and go out into public. These are worries that don't go away, and they worsen over time if they are not dealt with, because something really interesting happens in an anxiety disorder. There is a fear and people avoid the thing that they're afraid of, and their whole body goes, whew, avoided that fear, do that again. That kept you safe. And it actually strengthens that fear the next time it comes around. Think public speaking. All right, so I'm afraid of something, I avoid it because it felt like danger, and then I experience the relief of that, and then the next time that fear rears its ugly head, I feel compelled to avoid it again because I have to avoid that discomfort. You follow me? All right. So there are lots of anxiety disorders. I'm going to explore a few of the diagnosable anxiety disorders with you today. And of course, this video is not meant to help you diagnose yourself. That needs to be done in the face of a professional because there are many differential diagnoses. There are many disorders that share symptomology, and you need to have a professional in front of you so you can flesh out the symptoms with them together and choose the appropriate course of treatment. This is purely meant to be informational and may direct you toward seeking professional help. All right, so the first anxiety disorder is generalized anxiety disorder. Now, generalized anxiety disorder involves feeling restless, wound up, on edge, easily fatigued, having difficulty concentrating, headaches, stomach aches, muscle aches, unexpected pains, a lot of somatic complaints with generalized anxiety disorder. And they have difficulty controlling feelings of worry. There are sleep problems, both falling asleep and staying asleep. All of those are extreme in generalized anxiety disorder. So again, this is more than just your run-of-the-mill every day, I've got to worry about this thing or about that thing. This is a generalized worry and anxiety that worsens over time that impedes daily living due to its severity. All right. The next anxiety disorder is panic disorder. Now, panic disorders are interesting. They're often mistaken for heart attack. I want you to seek treatment if you're experiencing these symptoms. We always say in mental health, we need to rule out the physical before we can treat the mental facets of things. Because if a panic disorder actually is a heart disorder when somebody presents to us, there's very little we can do using mindfulness and cognitive behavior techniques if it is in fact a physical illness that is presenting. So if you're experiencing the symptoms of a panic disorder, you would have sudden intense fear or discomfort, a sense of losing control, often without recognizing a trigger. Now, not everyone who has panic attacks develops a panic disorder. There are lots of instances recognized where people have one instance of a panic attack and it never happens again. I guess those people can consider themselves lucky, because a panic disorder is debilitating to people. It involves pounding hearts, racing hearts, trembling or tingling, chest pains, feeling out of control, a sense of impending doom in this out of controlness. People who have panic attacks also worry about the next panic attack, and that worry of the worry of actually can fuel more panic attacks. People with panic disorder experience panic attacks up to several times a day, sometimes as infrequently as several times a year. But that fear of stops them from engaging in activities of daily living, stops them from living the lives that they would like to, because they're afraid that this is going to happen again. So again, very different from an occasional anxiety or fear. Social anxiety disorder is the next anxiety disorder, and as you can probably guess by its name, it impacts how we interact with others. So it's an intense and persistent fear of being judged or watched by others. Sometimes when I say that, I think the middle school years, the teenage years, right? But it is that intensified. So there is an egocentricity to certain age groups, but this is above and beyond that, and it can occur at any age. Sometimes the social anxiety gets in the way of work or school, because as you can imagine, if you have an intense fear of speaking to others or being around others, this intense fear of being watched or judged, it would be really difficult to interact with other people. So people with a social anxiety disorder experience intense blushing, sweating, trembling, stomach aches. They often have a rigid body posture and very soft speech. They have difficulty making eye contact, and they have feelings of self-consciousness or fear of negative judgment. And this intense fear of negative judgment stops them from engaging in a way that they want to. It is debilitating to people with social anxiety disorder. And again, like I said right at the beginning, when people avoid social situations and then they feel more comfortable, they're like, whew, social situations are scary, so I'm not going to engage in them because I'm safer when I'm at home. So social situations are scary. I avoid it, I feel better. Whew, I need to avoid social situations. And the anxiety loop, that negative feedback loop, fuels me into staying home and not addressing the anxiety, and it becomes disordered. Now, phobia-related disorders are in the field of, think spiders and snakes and heights and social phobia. Social anxiety disorder can be put in this category as well. It's an aversion or an intense fear of a specific object or situation. Though it can be realistic to be afraid of some of these things, think being afraid of heights, because if I fell, I would be injured. This is intense, and it's actually out of proportion to the real danger. So if I have a fear of spiders, I might not be able to turn on the light by my front door when it's dark, because I'm afraid a spider might be on there and I'm just frozen. I can't even move because I'm afraid there might be a spider, because once there was a spider on a light switch, right? Or I can't walk out into my garage because there might be spiders there. And now I'm avoiding that whole space because of my intense fear of this thing. Sometimes people have an intense fear of driving over a bridge and they have to find new ways to go to their place of employment, or they don't take a place of employment that requires them to cross a bridge. So that it's impacting their activities of daily living again. They take active steps to avoid that feared object or situation. There's an immediate and intense anxiety when they see something that is related to that specific fear. So if I'm afraid of spiders and I see out of the corner of my eye something moving and it looks like it has lots of legs, that intense fear rises up, and it might just be somebody's hair blowing in the breeze beside me. There are lots of specific phobias, heights, flying, snakes, spiders, injections, blood. Social anxiety, social phobia, like we discussed earlier, that avoidance of social situations and people in general. Agoraphobia is diagnosed when there's a fear of two or more of the following things: public transportation, open spaces, enclosed spaces, standing in line, or being in a crowd. If you have two or more of those fears, you can be diagnosed with agoraphobia. And again, it's not just, I don't like that situation. It is that intense fear that causes people to withdraw, and it impacts their activities of daily living. They might have those heart palpitations, their heart's beating so quickly and so hard, and they're sweating and they're fearful and they're sick to their stomach. They just can't go there. Separation anxiety disorder is usually diagnosed in somebody younger than 5 years of age, and it's that intense fear and reaction to separation from an attachment figure. It may cause young people to throw temper tantrums, or to cry inconsolably, or to hug on their attachment figure. Anxiety disorders and people who have anxiety disorders share certain risk factors. Often there is a genetic component. Somebody in the family has been diagnosed with an anxiety disorder previously. That's why it's so important when you're going to see a counselor that if you have certain disorders in your family, certain diagnoses in your family, let your counselor know so they can just be watching for things and they can know how to work with you better. Also, people who are born with certain dispositions, the more sensitive, the shy disposition can be more predisposed to developing anxiety disorders. And it follows. Remember, if we're afraid of something, if we're shy and we avoid it and we feel better because we've avoided it, it reinforces the fact that, not correctly, but it reinforces the fact in our mind that that was something I was supposed to avoid. So you can see how that could build upon itself. There are other things that can contribute to anxiety disorders, and often heart conditions can contribute to anxiety disorders. If people have AFib or other heart conditions and they already have an anxious type of personality, then they're feeling these sensations in their body and it flips them into anxious loops, and they make connections to external factors based on what's going on inside. Caffeine and other medications can mimic the sensations in the body that go along with anxiety disorders, and coupled with different experiences can create a situation that develops into an anxiety disorder. Now, it sounds very dire, right? We've got these situations and these sensations that impact activities of daily living, but they can be treated. So they're not life sentences. Even if you have a current anxiety disorder diagnosis, you can receive treatment for it. Cognitive behavior therapy and exposure therapies are two of the most researched therapies related to treating anxiety and anxiety disorders. Remember that feedback loop. If I'm feeling anxious, I have a fear and an anxiety about a situation, and I avoid that situation, and then I feel better, which reinforces the fact that I should be afraid of the situation. Exposure therapy works absolutely opposite to that. So I feel the anxiety, and I look at the situation and I assess, this is me feeling anxious, not just me feeling anxious, because that anxiety is incredibly uncomfortable. But if I can work with a counselor and get to the point where, okay, so I am anxious in this situation, but I'm actually safe. That's my anxiety. It's not actual fear. And I lean into it and I recognize, wait a second, I can actually go into that grocery store where people are watching me get my groceries, and most of them aren't paying attention to me anyways. They're looking at their phones. And I can go into the grocery store and I can buy a few things and I can check out, and I get back in my car and I realize, wait a second, I did that. It was hard, but it really wasn't anything to be avoided. Next time it gets a little bit easier, and it gets a little bit easier. And so the more I do that, the more I recognize, wait a second, this anxiety isn't something that needs to hold me back. I can tolerate that discomfort. Acceptance and commitment therapy has a lot of mindfulness-based activities that it has us engage in as well to calm our state, how we're feeling at the time, different breathing techniques to calm down, to slow our heart rate, right? Because that's connected with those sensations. And then over time, if I'm using mindfulness-based meditation and breathing techniques regularly, I can actually change the trait that I have, which is a more anxious trait, to be a more calm trait. And when I start in a more calm set point, I can then lean into the things and again, start teaching myself that I don't need to be anxious in these situations. Of course, there are medications also that can be helpful, beta blockers and certain anti-anxiety medications. What research has demonstrated is that anxiety medications work, meditation works, and counseling works, but they work best when they are used together. A previous supervisor of mine would say medication or meditation. So if you are somebody who doesn't want the side effects of medication, then lean into mindfulness-based meditation to be able to calm the mind and the body down. Anxiety and anxiety disorders are not something to laugh at, to take lightly, but they're also clearly not something to avoid. We need to lean into the discomfort and seek treatment so that we can enjoy everything that there is out there that we would like to enjoy. I hope that you learned something today, and I hope that you reach out to a mental health counselor if you think you are suffering from an anxiety disorder. As always, if you enjoyed this, please hit the thumbs up button, like and share. Let other people know that resources like this are out there, because mental health is important and you are important. I'm so glad that you joined me here today. Join me back next week here at Orange Therapy on YouTube, where you are welcome, just as you are.